Hello, in this video we are going to look at medicine and related courses under Kenya University College Central Placement Services, and we are going to check which courses are available under this category and which grades can do which courses and the subject requirements for every course under this field. So before we continue, make sure you subscribe to this channel and press the notification button for the incoming videos. The other video I discussed about other courses which are not medicine and related, and I moved from cluster 1 to cluster 12, and now this is cluster 13 under the field of medicine and health related courses. So if you missed the other video, kindly check that video in this channel and get to know the courses that you can do which are apart from the field of medicine and health related. So in this category, we have 5 classifications. We have from class A to class F, and I'm going to go line by line so that you get to understand. In class A, we have courses with the following minimum subject requirements: biology B plain, chemistry B plain, mathematics or physics B plain, English or Kiswahili B plain. Those are the subject requirements, and class A represents the courses which are more competitive, and these courses demand strong performance in sciences and languages, and they prepare students to direct clinical and surgical practices. And in this category, in this class A, we have only Bachelor of Medicine and Bachelor of Surgery, and we have Bachelor of Science in Dental Surgery. So those are the two courses in that class A of medicine and related courses. And I've said the subject requirements is biology B, chemistry B plain, mathematics or physics B plain, English or Kiswahili B plain. We have class B. Class B of courses, the requirements are biology C+, chemistry C+, mathematics or physics C+, English or Kiswahili C+. When I talk about English or Kiswahili, I mean you can have either Kiswahili C+ or English C+. When I talk about mathematics and physics, it's either of those two. Ukuwe na grade ya C+. So those are the requirements, and these are the courses available in that class B category. We have Bachelor of Science in Pharmacy, Bachelor of Science in Pharmaceutical Sciences, we have Bachelor of Science in Environmental Health, we have Bachelor of Science in Optometry and Vision Sciences, we have Bachelor of Science in Physical Therapy, we have Bachelor of Science in Physiotherapy, we have Bachelor of Science in Public Health, we have Bachelor of Science in Nursing, we have Bachelor of Science in Medical Laboratory Sciences, we have Bachelor of Science in Clinical Medicine, and we have Bachelor of Science in Midwifery and Reproductive Health. Those are class B courses with subject requirements of biology C+, chemistry C+, mathematics or physics C+, and then English or Kiswahili C+. We have class C. Class C, this focuses on preventive health care, community health services, occupational safety and health management rather than direct clinical intervention. And the subject requirements for these class C courses are biology C, chemistry C, mathematics or physics C, English or Kiswahili C. Courses under this category, under this class C, they are Bachelor of Science in Occupational Health, Bachelor of Science in Community Health and Public Technology, Bachelor of Science in Occupational Therapy, Bachelor of Science in Population Health, Bachelor of Science in Community Health, Bachelor of Science in Global Health, Bachelor of Science in Health Services Management. That is class C of courses, and I've given the subject requirements for all those courses. We have class D. Class D, this is just one course, Bachelor of Veterinary Medicine, and the subject requirements is biology C+, chemistry C+, mathematics or physics or agriculture C+, either of those three C+. So the requirements are biology C+, chemistry C+, mathematics or physics or agriculture C+. Now, we have some issues with students who think they can pursue medicine related courses without biology. You will not be allowed to do medicine and related courses if you do not do biology in high school, because medicine is all about biology, rotates under zoology and botany, and you must have done biology for you to proceed with a medicine related course. So I'm done with class D. It's only veterinary medicine, and I've said the biology, chemistry you must have C+, and either of mathematics, physics and agriculture to have a C+. We proceed to class E. Class E are courses which requires you to have biology C+, and mathematics C+, only those two subject requirements. And the courses are Bachelor of Science in Biostatistics and Bachelor of Science in Epidemiology and Biostatistics peer. So those are class E courses, and we move to class F courses, which comprises of 4 courses, and the subject requirements are biology C+, physics or mathematics to have C+. So you're going to make sure that you have a biology C+, and either physics or mathematics C+. And the following courses lie under that category. That is Bachelor of Science in Biomedical Sciences, Bachelor of Science in Laboratory Sciences, Bachelor of Technology, that is Science Laboratory Technology, and Bachelor of Science in Medical Psychology. Then we have the last class, which is class G. The subject requirements for those class G, it's biology C minus, mathematics C, English or Kiswahili C plus, physics or chemistry to have C plain. And we have only Bachelor of Science in Health Records and Informatics. So definitely that is what this field of medicine and health related courses comprises of. 8 years from class A to class G, and those are the courses and subject requirements under those classes. I have some concerns because most students tend to think that they can pursue a certain course with maybe one subject. Tuseme, in class B, there are courses which requires you to have a biology in C+, chemistry C+, mathematics or physics C+, English or Kiswahili C+. You find a student who has met all these requirements except biology, where you're supposed to have C+, yeye ako na C constant, and then he or she is crying to do that course under that category. You must fully meet these subject requirements without exception. If it's 5 subjects which are required with a grade of C plus and above, then you must have those 5 subjects with a grade of C plus and above. There is no exception. I've qualified 4 of them and then my chemistry is down. You will not be excused to proceed with that course. So I think that is the overview of the classes under cluster 13 category, and cluster 13 category is medicine and health related courses. Now I would like to move to a very sensitive question where students now cry to fit. Mtu ako na C plus na anataka kufanya nursing. Now, this second session is going to be of essence, so you can pause and then come back. We proceed. We proceed now with the issues to do with cluster points. Whatever I'm going to talk right now is going to touch more on cluster points. Cluster points applies to students who are going to do the application through Kuccps, or students who are going to be government sponsored. The story to do with government and self-sponsored is in another video in this channel, so kindly go through the videos in this channel and get to know the difference between being government sponsored and being self-sponsored student or parallel student. So whatever I'm going to talk right now is based on students who are going to be government sponsored, or else students who are going to do the application through Kuccps or Kuccps. So this, it's an overview of what is going to happen, because I will not narrow down to a specific students, but generally in terms of cluster points, this is what happens. We have these competitive courses. Remember, previously I've talked about subject requirements and what you're supposed to have in terms of subject for you to qualify to do a certain course. You can qualify to do a certain course in terms of subject requirements and fail to meet the cluster points, therefore not fulfilling the two conditions of Kuccps, therefore not being eligible to do a certain course. But if you'd like to be a self-sponsored student and you qualify in terms of subject requirements, then you can go and apply direct to the school, and therefore the consequences or the terms and conditions for self-sponsorship applies. I've said if you don't differentiate between being a government sponsored and a self-sponsored, that is parallel, revisit the videos in this channel. You're going to understand the difference between being self-sponsored and being government sponsored. So whatever I'm going to base now, I'm going to look at courses under Kuccps that is under government sponsorship. Now, students with strong A minus and above, that is 78 points and above, they can pursue the following courses: medicine and surgery, Bachelor of Pharmacy, Bachelor of Science in Clinical Medicine, Bachelor of Science in Dental Surgery, Bachelor of Science in Nursing. And if your grade is below 78, forget about these 5 courses. That is in terms of cluster points. Get me very clearly. This is in terms of cluster points. You can meet the minimum subject requirements. That is, in medicine and surgery, you must have biology B, chemistry B, mathematics or physics B, English or Kiswahili B. You can meet those subject requirements, and because of the cluster points, fail to qualify for this course. But you can enroll as a self-sponsored student without applying through Kuccps and then qualify. So if you are not differentiating between being self-sponsored student and being government sponsored student, revisit the video with the topic self-sponsored and government sponsored in this channel, and you'll differentiate between the two. So if you want to do your application through Kuccps and you have a grade below 78, then forget about these 5 courses: Bachelors of Medicine and Surgery, Bachelors of Pharmacy, Bachelor of Science in Clinical Medicine, Bachelor of Science in Dental Surgery, Bachelor of Science in Nursing. But You can see nimeweka brackets in Bachelor of Science in Nursing with a strong 76 and above. You can qualify for nursing in some small universities. So unaona kwa medicine and surgery nimeweka 80 points and above. Unless stated otherwise, you cannot qualify for medicine and surgery without 80 points and above. If you want to do pharmacy, you must have 79 points and above. I'm talking about the cluster points, and I've just done approximately because now you may have very strong grades in the subjects which determine the cluster points, and maybe have 78 and qualify for pharmacy. So I'm just giving generally in most cases, and 98%. If you have 79 and above, you can do pharmacy. If you have 80 and above, you can do medicine and surgery. If you have 76 and above, you can do nursing. Those students with weak A minus and above, that is students with 74 points and above, can do the following courses. Number one, Bachelor of Science in Optometry and Vision Sciences, Bachelor of Science in Physiotherapy, Bachelor of Science in Radiography and Imaging, and Bachelor of Science in Veterinary Medicine. So these courses with 74 and above, you can qualify and you can choose university that meets your cluster points and make sure that you go to school. We have another group of students with strong B plus and above. That is 70 points and above. That is a strong B plus and above. You can qualify for the following courses. Number one, Bachelor of Science in Medical Laboratory Sciences, Bachelor of Science in Physical Therapy, Bachelor of Science in Midwifery and Reproductive Sciences. Those are courses you can qualify with 70 and above. Remember, I'm just giving an overview of what might happen. This is to prepare you find alternatives just in case whatever you are dreaming will not facilitate whatever you are dreaming will not fit what you got. You can now find an alternative and make sure at least you have alternative just in case application period starts and then you find that you don't qualify for this course, then you can have an alternative to put as your number 2, 3, or 4. So I strongly agree that students with strong B plus and above, that is 70 points and above, can do Bachelor of Science in Medical Laboratory Sciences, Bachelor of Science in Physical Therapy, Bachelor of Science in Midwifery and Reproductive Sciences. I know it is not, I know most of you will not accept this reality, but this is what happens. And you cannot evade, you cannot go away from this fact. You cannot have a C plus and then do a degree course in medicine and surgery. You cannot have a B plain and then think that you can qualify to do pharmacy and a government sponsorship. You will not, unless you enroll as a self-sponsored or parallel student. So it's a bitter truth, but it's good you accept the situation and try to find a way out of this situation, because I've shared another video with the other clusters, the courses which are away from medicine, which are business related, computer related, engineering related, law, social sciences. You can look at other best courses under those fields if medicine does not fit your grades. We have students with B plane and above. Students with B plane and above can pursue Bachelor of Science in Public Health, Bachelor of Science in Environmental Health, Bachelor of Science in Population Health, Bachelor of Science in Occupational Health, and then Bachelor of Science in Biomedical Sciences and Technology. Then we have a group of very beautiful students with C plus and above. We have a list of 7 courses that you can pursue with C plus and above. We have Bachelor of Science in Public Health, Bachelor of Science in Environmental Health, Bachelor of Science in Population Health, Bachelor of Science in Biostatistics, Bachelor of Science in Health Systems Management, Bachelor of Science in Epidemiology, Bachelor of Science in Health Records and Management, Bachelor of Science in Medical Psychology, Bachelor of Science in Medical Social Work. Those are courses that you can pursue with C+ and above. Remember, if you would like to do medicine related courses, you must have done biology. You must have performed well in mathematics. Before I close this video, I want to give an advice that you may find this is for the students with 7980. Mostly those students, you find that they qualify very beautiful courses like medicine, surgery, pharmacy, clinical medicine, dental surgery, nursing. But now you find their cluster points, yes, they meet those universities which are top classified, and they opt to choose those big universities, not knowing that those universities are very competitive and it is very difficult for you to get chance in those big universities. I advise it's better you choose a small university and be guaranteed that you'll go to that small university. Or rather, it's better you choose a small university that completely meets your cluster points so that you qualify and you go to school instead of putting big universities in your application and then failing to meet the cluster points, hence failing to get placement. That is not what is supposed to be done. It's better you choose a small university to do a very big course rather than doing a small course in a big university. For instance, a student may have a 79 points. That student can qualify for pharmacy in a small university like Seku or a small university like Taraka University. And then because the students think that it's well to go to Kenyatta University or University of Nairobi, the students decides to go down and choose a small course like Bachelor of Science in Public Health. With a 79, you decide to go to Kenyatta University to do Bachelor of Science in Public Health. That is not a good decision. It's better you go to Kisii University and do that medicine and surgery rather than you going to Kenyatta University to do environmental health. I don't know whether you are getting the sense of what I'm talking about. And if you listen and decide to do the course that fits your grade in the small university, however the small, so long as that course, so long as that university is accredited university, then there is no harm with that. So I advise you all choose a good course over a big university. I think that is very clear. Choose the very best course. Do not choose a big university to do a small course. Choose a strong course and go to a university that meets your cluster points. In case you don't understand the issues to do with the cluster points, press the notification button because the next video I will talk about cluster point analyzation and how you are supposed to compare the cluster points and how you are going to check whether you qualify a certain course in a certain university in terms of cluster points, because I've said, remember, you can meet the minimum subject requirements and fail to be placed because of very little cluster points. So I will make a video next to talk about the cluster point analyzation and comparing the cluster points of previous years with your current cluster points to make sure that you do a guaranteed application. So press the notification button as we wait for that another video. Otherwise, I wish you all the best. Continue being tuned into this channel. Lovely time.